One of the greatest investments we can make is in our health. With good health, it's easier to have well-being in other areas of life. Hi, I'm Kevin Harrington. We all have a responsibility to ourselves and our families to take our health seriously. Join me in discovering the latest in this vital industry. This is Health Briefs. Advances in medical technology are being made every day, improving our lives exponentially. This is the next generation of medical technology.
Trichomonas vaginalis is estimated to be the most common curable non-viral sexually transmitted infection today. There are 248 million new cases of trichomonas worldwide each year, with approximately 7.4 million cases occurring annually in the U.S. Trich, as it's often called, is more common than chlamydia, gonorrhea, and syphilis infections combined. Despite this incidence, it's still largely viewed as a nuisance infection and is often underdiagnosed and undertreated.
Trichomonas is a single-celled motile parasite, which is transmitted between men and women by sexual intercourse. In the general population, about 2 to 3% of the women may be infected, but in women who have vaginal complaints, the prevalence may be as high as 18 to 50%.
Trichomonas costs the American healthcare system $36 million each year. Left untreated, trich carries serious health consequences, including preterm birth, infertility, cervical cancer, and increased risk of HIV. The need for acceptable, available point-of-care tests for diagnosing sexually transmitted infections like trichomonas is significant.
Point-of-care tests for trichomonas are important because they can allow the organism to be identified immediately. Women who have a laboratory test for which they have to come back to get the results may never come back and may never get those results.
When it takes days for test results, patients tend to get lost in follow-up, and tracking them down for treatment is often difficult.
There are a number of options for diagnosing trichomonas. The motile organism can be viewed under the microscope, or it can be cultured. It can also be detected and diagnosed with molecular methods, but they also are more expensive and they require a trained laboratorian. Point-of-care tests, on the other hand, can be performed by a non-laboratorian generally, and they also allow for a test and treat approach.
Diagnostic tests and systems from Sekisui Diagnostics can help provide the fast, cost-effective, and reliable point-of-care results doctors, patients, and researchers expect.
Sekisui Diagnostics is a global diagnostics manufacturer located in Lexington, Massachusetts. We have 500 employees in 10 sites operating in 4 countries worldwide. We determined that a rapid, highly sensitive test for trichomonas was an unmet need at the point of care. Current tests are either too expensive, provide poor sensitivity, or the time to result doesn't allow for effective care in the doctor's office.
Sekisui Diagnostics' rapid point-of-care testing solution is the Awesome Trichomonas test.
The Awesome Trichomonas test is unique in that it's the only CLIA-waived test available on the market today. This allows for testing in any clinical setting, providing results in just a few minutes. This allows the healthcare provider to provide effective care immediately, without losing the patient to the follow-up process.
Testing for trichomonas with the Awesome test is simple and quick.
The Awesome test procedure is simple and requires only 30 seconds of hands-on time. After the specimen is collected, the healthcare provider adds the sample buffer to the test tube, inserts the swab, and mixes. Next, the test stick is added to the tube, and the results are available in 10 minutes. 2 lines indicate a positive result, and 1 line a negative.
The ability of the Awesome Trichomonas test to accurately, quickly, and cost-effectively detect trichomonas offers significant benefits to patients and clinicians. Diagnosis and treatment can occur in one visit. This helps to improve patient outcomes, lower healthcare costs, and helps prevent the spread of sexually transmitted infections, such as trichomonas.
If the clinician knows that there's trichomonas present, they can use immediate treatment. Metronidazole and tinidazole are 2 drugs that can be used to cure trichomonas. Another advantage is that the transmission during the time period when a woman would have to wait to come back to get her results, that whole transmission period is prevented because of the immediate treatment.